Okay, so now we're going to calculate the patient's responsibility based on the charges that have already been put in for the patient's visit for that day. Now this is sort of a unique circumstance. Let's say John came in and we checked him in, but we didn't collect any money from him when we checked him in. So he went to go see the therapist. The therapist did the note up for John and completed the note. So the therapist has already put in charges for that visit. Now on his way out, John can pay his coinsurance, his responsibility, based on the charges that the therapist has already put in there for that day's visit. So this is sort of like a check-out procedure. So John's done with therapy. He comes to the front desk to check out. We can right-click on his appointment and go to Apply Patient Payment. That'll bring up this screen, which is pretty similar to the check-in screen, but using this screen you're not actually checking the patient in, you're just collecting money. And you see what it's doing here is it's giving me an estimate of what the patient's coinsurance is going to be based on the current visit. When I click the ellipsis, you can see that radio button is selected for today's visit. So that can be used if the note is locked and charges are entered. So that's been done. The patient has already been seen. The therapist did the note and entered charges. So now we know what the charges are going to be for John for that day. And it's calculating the coinsurance based on those charges. Now there are a few miscellaneous things that you just want to be aware of when it comes to estimating the coinsurance, and we're going to go through that next. Okay, now we're going to take a look at how setting up a deductible in the patient's case can affect the amount that gets collected at check-in. Let's take a look at Sally as an example. I'm just going to right-click on Sally and go to check her in like normal. And you see when I go to do that, it's asking me to collect $19.20. And the reason it's asking for $19.20 is it's looking at a visit that we had for Sally previously, and it's looking at the codes that were in that visit, and it's looking at the allowed amount, the amount that was allowable for those codes. And it's totaling that up. It's getting $96. So it's taking 20%, her coinsurance is 20% of that $96. And we're getting $19.20 from that. So that's the amount that we want to collect. Now let's say that Sally has a deductible that she hasn't met yet. What we can do then is go into her patient navigator and go into that case, and in the payer tab we can go and verify her insurance. And this is where we can set up all the information, including the coinsurance. You see there's also a field here for the deductible. I'm going to set her up with a $100 deductible. Obviously your deductibles are usually going to be more than that, but I'm just going to set it up for $100 as an example. So we'll set that up for $100, we'll save it, we'll close out of here, and now when I go to check her in, see it's asking me to collect more than just that 20% that we had before. Now I'm going to collect 96, which is actually the full amount of the allowable. Because Sally's got a $100 deductible, she hasn't paid any of that down yet. So we want to collect as much money as we can from her until she actually does pay off that deductible. And the most we can collect is the allowable amount, the amount that we expect to, that we would normally receive from the insurance. So that's why we're getting $96 there. That's the patient's responsibility. So we can go ahead and apply a $96 payment, just like we do for a copay or a coinsurance, and check Sally in and collect that. And that'll go towards her deductible, so the next time we go to check her in, that amount will be reduced. And that really concludes this instructional training video. So hopefully that helps you get started with this new part of the program. But if you do run into problems and questions, please don't hesitate to contact our technical support. You can email support@rehabsoftware.com, or you can call 866-562-8413, extension 2 for technical support. So thank you very much.